Welcome back. We have so many questions from viewers. Let's listen to Danielle Edmond of the North Side.
Doctors, my question is, do you advise people not to take other medications on the day they'll be receiving the vaccine?
And Dr. Isaac, that's a perfect question. What about other medications when you're getting the vaccine?
So when they did the trials for the vaccine, they included people with all types of diseases and illnesses on all types of medications. And these weren't stopped because of the vaccine. But having said that, the CDC has now recommended that people do not pre-medicate just anticipating pain or swelling or something. Just they don't pre-medicate with NSAIDs like Motrin, ibuprofen, or Tylenol prior to getting the vaccine. It's perfectly okay after they've gotten the vaccine and if they develop some of those symptoms to take those types of medicines. But they suggest that you don't do it on the day of, right before the vaccine, thinking you're gonna get ahead of what pain or discomfort that you might have. Also, they recommend don't try to take, just over-the-counter antihistamines, thinking you can prevent an allergic reaction, because it won't necessarily prevent the reaction, but it might kind of mask some of the symptoms that you're having so that you might get into trouble a little later on. So basically, don't pre-medicate, but take your regular medications.
Take your regular medications. And we don't have too much time left. And Claudia, I want to circle back to you because so often first line of communication is with the nursing staff. So a lot of times you don't get to talk to the doctor before you go in for a vaccine or something like this. How important is it, do you think, that people feel comfortable with their nurse, with their doctor, to be able to ask some of these questions on a regular basis?
I would simply say that even if you don't feel comfortable, speak out. You have to be the first line of defense for yourself. That's the most important part. As nurses, we are trained to listen. We listen real carefully first. And if you can find a nurse that you have a question, just blurt it out. Don't try to find the right way of saying it, because she's going to figure out a way. He or she is going to figure out a way to get that answer to you. But the thing that I would leave this whole discussion with is trust your healthcare professional, that they, especially if they look like you, because we're all in this together. And it doesn't do us any good to see us fail. And so we don't want to see you individually do that either. But yes, they say that nurses are the most trusted profession. Trusted because we listen more than we talk. And we really exhibit that caring, and so will all of your other healthcare givers, from your dentist to your bartender and your lady in the beauty salon. Speak it out. Don't hold it back. We want you to be in charge of yourself and you to identify what needs to be done for you.
And, Dr. Rhonda Johnson-Moore, we got 30 seconds left. So many of you are connected to the Black Equity Coalition. And that's key to all of this as well, establishing that there are people that look like us who have the expertise that can give you the information that you need when it comes to this vaccine.
Yes. And don't hesitate to look for sources online, such as the Centers for Disease Control, or the Allegheny County Health Department, or the Gateway Medical Society that Dr. Isaac sits here as our president. There's a lot of information, but try to avoid that. If it doesn't sound right, if somebody tells you that the vaccine, for example, connects you to a microchip, which connects you to the internet, I mean, really, folks, that cannot be possible, And so if it doesn't sound right to you, then it's probably.
If it sounds crazy, it probably is crazy. Thank you all for joining us today. Great information. I appreciate your time and your knowledge. And I'll be back in just a minute to wrap all of this up. Don't go away.